So this example comes from when I was working at Clover Health. We're going to go through the whole SIDE process for each of these examples because, again, I think it just helps us to hear how people are doing this. That's going to help you develop those instincts to help get you better at this. And then there's no reason not to do it yourself. So this is an example around flu shots. I've written about this many times. So again, the executive team comes and says, we want people to get more flu shots. Hey, remember strategy. The first thing we have to do is go figure out, what does that mean? Is that flu shot claims? Is that sort of just getting the flu shot? Doesn't matter if we get a claim. Is it only a subset of the population? Is it all Clover members? Is it some Clover members? Doesn't matter, right? We also here did a little bit of sizing around how much is it actually worth. So when I asked people around the organization, how much do you think, getting a flu shot is worth? Most people estimated around $10. And it turned out, using actuarial math, when we started to factor in, keeping people out of the hospital and preventing death and all of the other things that, the negative externalities of flu shots, plus the fact that, it's one of your, measures by which the government pays you. It turns out it's worth about $100, right? This is really important because there's a huge difference between the intervention I can do for $9, right? If I only make $10, I have to spend less. So I can only do things for $9. There's a really different intervention I can do for $99, still make the same $1 profit, but hugely different interventions. So that's really where we got to. Hey, it doesn't matter if there's a flu shot claim. It's about really administering flu shots, and it's worth about $100. So the key insight here came from the started category. We're talking to people who, hadn't got flu shots previously, all of a sudden started getting a flu shot. And we started to hear this repetition thing, which is something changed in their life outside of the flu. So it wasn't around things like, well, did they get the flu last year, right? If they got sick last year, maybe they were more likely. Oh, that didn't turn out to be true. It wasn't stuff like that. It was about, hey, I have a new thing. So specifically heard, for example, hey, I have a new grandbaby and my daughter wouldn't let me see the grandbaby unless I got a flu shot because, babies are vulnerable to the flu. Okay, so it's really not about the promoting pressure that is preventing yourself from getting the flu, being healthy on your own. It's about all these other things that being healthy lets you do. Okay, that's interesting. Now, it happened to be true because of how we were set up at Clover that we knew, hey, what's important to people? We'd done this interesting experiment where when people came into the plan, we asked them, hey, what's important to you? We then took all of those free entries, we coded them into 6 or 7 different buckets. And so we could sort of auto-categorize people's desires into those things, activities. Hey, there's a thing I like doing, travel, religion, all sorts of different things that people had sort of gone through. And so we needed to do a pilot. So what was the pilot that we did here? Well, we picked people who hadn't gotten flu shots in the last couple of years, right? And had. So we want a good diverse sample. And then we divided a control group, a group of people who weren't going to get an intervention. Some people who we were going to send the same letter they got last year, right? Sort of the standard, you should really get a flu shot. It's good for you, that kind of health thing. And then a new letter that, contained what we call the motivational sandwich, right? It had promoting pressures. Hey, here's why, it's really important, that were customized and targeted to them. So if they said, hey, I really like to dance, then we would send them a letter that said, hey, if you get sick, you won't be able to go dance because you won't be able to, you won't feel like doing it. You want to get other people sick, right? So we said, hey, there's something you really care about. Here's how the flu relates to that thing, right? That's the sort of top layer of the sandwich. Then we had inhibiting pressure reduction, and here's how easy it is to get, and here's all the locations you can do. If you need help, we'll help you. Like all of the, it's free, right? Covered by your health plan. Your PCP can do it. All of these inhibiting pressure reduction things. And then reiterating that message again and again, that promoting pressure message. So promoting, inhibiting, promoting, that motivational sandwich. And so again, remember, I can't go ask the mailroom to send these because I don't have any evidence it's going to work yet. So instead, we literally print them out on a LaserJet printer. We had a little party where we fold them all up, put them in envelopes, addressed them, put on stamps, and sent them out. And that was how we did our communication. And lo and behold, we did see a pretty big increase. It was in the sort of double digits absolute percentage increase, which is a lot. And a really cheap intervention, right? So you can imagine our outcome statement was, hey, scaling this is going to be pretty easy. We can do most of it programmatically. We have a mail merge template and all the things we need to do it. The mailroom's all queued up to do it. It'll cost some number of hours and a little bit of setup time, but then it's just going to cost printing and postage, so somewhere around $2 a member. But the expected value at $100 per flu shot was dramatically higher. If we're getting 18, 20, 15% of people to do this, well, if it only costs $2, you don't really need that many people to do it to justify that when it's a $100 spend. So this really worked well. It's a strong pilot that led to scaling.